and childbirth. And I have a guest from Gbagada General Hospital here in Lagos, and that's Dr. Adegboyega. And of course, not forgetting that I have the head of programs for Lagos Transfusion Services, also here in the studio, Mr. Oluwole Olatubi. Good afternoon. Welcome to the show.
Yeah, well, thank you for having us.
All right. I need you to move closer to the microphone, yes, so we can capture your lovely voice. Okay, so let me start with you, Dr. Adegboyega. How crucial is blood availability in emergency obstetric care? That's for reducing maternal mortality cases.
Okay, thank you.
In your experience, yes.
I think it's important to let people know what we mean by emergency obstetric care.
Yes.
You know, like a set of medical conditions that occur in that they are a set of medical medical condition that needs their intervention during childbirth. Okay, so it could be basic and comprehensive. Availability of blood transfusion services is part of the comprehensive emergency obstetric care. The other aspect is availability of surgery, emergency cesarean section. So it's very, very crucial because a woman can die immediately within seconds, or if nothing is done, within 2 hours. So during childbirth. Yes. So if blood is not made available, the woman will die. So and no woman decides to die during pregnancy.
Okay. So also we have heard of situations, postpartum hemorrhaging, where you find some women could lose their lives, in that process also. Explain to us the role of blood transfusion in managing severe postpartum hemorrhaging.
Okay, thank you. When we say severe postpartum hemorrhage, that means that the woman in labor, so to say, or that has just delivered,
yes,
has lost about over 1.5 liters of blood. That means has lost blood such a way that she's bleeding. She's feeling like fainting. She's dizzy. The blood may even be, sometimes you may see it. Some are concealed blood.
Okay.
That means you don't see it. But by looking at the woman, she's pale, it's paper white, like paper, just the way it's described. And then you see that she may even be gasping. Sometimes you may see some that are concealed, and then when you check her pad, she's in the pool of her blood.
Wow.
So if your question is how blood transfusion, yes, you need to, the woman really need blood. You must give. In fact, is like the A of ABC in resuscitation.
Okay.
We have ABC of resuscitation, airway, breathing, circulation. But when you have severe hemorrhage, bleeding, it comes first now. You must give blood. It's very, very important to save life, or the woman will be gone. And we said one woman is dead, one nation is dead.
So I know that we have, the blood, maybe the need for blood or blood platelets or products, it costs across every strata, every social setting, any level. Yeah. So whether you're rich, poor, you're faced with, some people are faced with certain situations. But then how do you manage, what are those challenges that arise when you have blood products that are scarce in low resource settings? How do you manage it?
The challenges. Yes, like you said, blood is just part of, the human body is made up of fluid, blood, or what have you, lymphocyte and all that. You can easily walk into the pharmacy and get IV fluid for infusion, but you can't do that when you come about the blood. You can't walk into any pharmacy and get blood.
Yes.
So it's scarce. And then, so it's important for it to be available. Like the challenges it starts from when the woman is pregnant. It's not only a woman can die during pregnancy. And then the challenges start right before she even delivers. We can see, like they say, you can know how tomorrow will be from today. A woman that is entering into the voyage of pregnancy already with deficits, she's at risk of dying. The challenges include, for instance, to the baby and to the mother. You have challenges to the baby. To the baby may not grow well. You have something you call antepartum hemorrhage. Then the woman too, if he has other comorbidity in pregnancy, like placenta previa, that means placenta is coming before the baby. So that placenta abruptio, which is even imagined, if such woman goes on and blood is not available to combat that emergencies. Placenta previa is when placenta is before. I'm just using that as an example. Placenta is coming before the baby. The woman, most women have warning hemorrhages. That is, they just sleep, wake up and notice that they are bleeding. They are soaked in their blood. And then it can go on. If she continue contracting, she can bleed to death. And if such women, you bring them we identify them, and then there is need to provide, maybe they may need emergency cesarean section, that is, you operate them to bring out the baby. If blood is not available, and then the woman can have torrential bleeding within seconds or at most 2 hours, she's gone. So blood must be readily available, for such women. So, and then PPH too, what we call, that is during pregnancy. We have identified seatbelt injury. I've seen that several times. Is driving, she's pregnant, she applies seatbelt, and then there's a bang, or she had an accident. She start bleeding. She can rupture the uterus, and she start bleeding. Immediately, you need blood. So, to save the woman, to save the baby, to save the woman first. If nothing is done, she will bleed to death. Then PPH, she has delivered during delivery. There are some unanticipated things that you see during delivery. There's an expected amount of blood the woman should lose during maybe less than 500. That's when it's more than 500. We call it postpartum hemorrhage, and we must do something. Intervention must occur. So if a woman that is delivering suddenly, even if you give the episiotomy, you cut the woman to enlarge the birth canal, and sometimes some of these women, they are not cooperative, and she pushes and she tears. You have cervical laceration. Genital laceration is one of the causes of death, maternal mortality in labor ward. If blood is not available at that particular time, you want to give blood. Is part of your resuscitative measures, and you don't give those blood, the woman is gone. So we don't have time to buy. So blood must always be readily available for such women.
All right, it's still Safe Blood Arena on Lagos Traffic Radio 96.1. I have a text message here for our travel advisory. This person is coming, wants to know the station on Ikorodu Road. It was Independence Tunnel. You're coming from Anthony. It is still fine. From the live camera here, it's still fine coming from Anthony. Though on the service lane at Anthony, inward Idiroko, it is very busy. It's a steady movement. Yeah, slow but steady. And but inward Maryland is still fine. Independence Tunnel also is fine. Inward New Garage, so you're free to come from Anthony. You're free to access. But if you also want to go through Gbagada is also looking fine. It's still good. Nothing to worry about as well. We have a lot more vehicles though. There's the rush hour, but it's still okay. So you're free. And all right, so now this is talking about your experience as a doctor. You've told us about the situation. So what exactly leads to scarcity, court-ruling banning policy of insisting on compulsory blood donation from patients or relatives or those seeking medical care and attention before accessing AMC, maternal or any health services in public hospitals? We've had one or two people say that, no, it's like this, no, it's like that. But what leads to the scarcity court ruling banning the policy of insisting that there should be compulsory blood donation from patients or from relatives or patients of those seeking medical care before they are attended to. You're a doctor, so let's hear from you, from your experience.
Okay, yeah. Well, we are dwelling into a little bit of politics here. Well, I think I'm aware of, I don't know whether there are other policies, but I'm aware of unions, some groups, civil groups, set up at the socio-economic rights and accountability
projects, yes.
You know, that there was a time that they wrote an open letter to our dear Excellency, dear Governor Babajide Sanwo-Olu, to appeal or to urge the Honorable Commissioner for Health here in Lagos, Professor Abayomi, to enforce, to stop this policy of women donating blood compulsorily as maybe a prerequisite before antenatal care. You see, let me take you back. When I was in our care house, our women, before we see them, when they book for antenatal care, they come early, maybe when they are 3 months pregnant and all that, and then before they get to 36 weeks, getting to 8 months, 9 months, they write it on their on their form, antenatal card, that we see those that have not donated, like we don't want to see them again and all that. So it's not that we don't want to say that, we encourage them to donate blood, and then we tell them, the usual thing that you must donate blood, bring your husband and all that stuff, so that our blood bank don't get dry. Because we know that during delivery there will be blood loss. So this civil group now says that it is a right of any woman. You must not be coerced into donating blood before you can be seen. So they have a right to attend antenatal clinic and deliver, irrespective of all the complication that has been noticed. But from my own experience, I think it's important. I don't know, maybe it's just my personal suggestion that there may be need for re-evaluation. Maybe through research, looking into cases like that in which we've lost women. Because to tell you the facts, from my experience now, I've been in ONG for some time now. Sometimes our blood bank are dry. The women, they come in, we see the emergency, we need blood. Sometimes we need to give them up to 10 pints, 8 pints, especially the referral cases. When they come in, they are bleeding, you need to do something. It can cause unrest. They start fighting, this woman must not die. So they started doing all that. So I think if I'm going to answer your question is what I think
the challenges. Yes.
The challenge is that if this blood, if we don't look into this, we may be experiencing, we will not be able to reach our sustainable development goal.
Okay, but then for women who are pregnant, say they are probably at between 6 to 8 months old. Is it okay? Is it safe for them to donate? It's not.
The women are not the one that will donate.
It's their husbands and relatives.
Yes,
so they have to make sure that whichever hospital they're registered at, they have to bring relatives who will donate.
Yes, it's good.
It's on their card. Something they have to do on their card.
They don't do it again.
Okay.
They believe the policy is ongoing, that it's been accepted that women, they don't donate blood. But when we appeal to them, when there is need, that we still tell them, please, can you donate blood? You may need it when the need arise. For instance, we want to do a cesarean section for that woman, or she's an ectopic pregnancy. Maybe ectopic pregnancy will not even occur in advanced pregnancy, but let's say a woman that has done previous cesarean section, 2 previous cesarean section, you don't know where it's going to lead. Previous cesarean section may start, maybe we reevaluate them at 36 weeks, may start contracting, and then after we take decision on whether she's going to we are going to allow vaginal birth after cesarean section, or we go straight forward to a repeat cesarean section. Such women will need blood. So we encourage them to just maybe they can do some researches, look at case reviews, so that we can look into this policy. And then I feel that they should encourage everybody to donate. People that can donate blood,
should
donate blood. Blood should be made available at all times, so that our blood bank don't get dry.
Okay. All right, it's still Safe Blood Arena on Lagos Traffic Radio 96.1 FM. Getting this question from someone who's saying Ikorodu Road is as a standstill from Fade Inward Anthony. Well, from what I can see on the camera, it's just the service lane that is, a slow movement. If you are coming from Obanikoro, Inward Anthony, of course, you know that those who are descending from the Corona Loop, they're going to be trying to connect Anthony at Anthony bus stop. So that will definitely cause some slow movement, because the traffic managers there will have to stop those of you who are coming from Obanikoro, so they can allow those descending Corona Loop to link up with Anthony. So aside from that, there's nothing else going on that I can see. But you can also avail yourself the opportunity of making use of the main carriageway, which is very free. But right now, there's no issue as far as I can see. And if there's anything, definitely we'll continue to find out. Control room, please do send us, let's help us do a review so we can see what is going on at Obanikoro and Anthony Inward Ijiroko. Because of time, let's briefly talk about examples of case studies of where you have had adequate blood availability, significantly reducing maternal mortality rate in a specific region. I don't know, have you've been at Ayike House. Have you been outside Lagos? So let's see if we can draw a comparison.
Yes,
okay.
I've been outside Lagos, I've been out of the country.
Okay.
The developed world, and I've seen the way it is.
Okay, so just give us an example of stations where you've had blood availability significantly reducing maternal mortality rate in a specific region, maybe outside Lagos, or outside of the country.
Okay, thank you. Okay, let me just give a scenario. The one that I was involved as part of the management. Okay. There was a woman that was in somewhere in Ikwetumodu.
Okay.
That's outside. Ikwetumodu is in around Ife area. It's a small place. It's like a primary health center, but maybe a comprehensive one. So there was a woman that was brought. It was an emergency. Was referred from think faith-based homes. Okay. No, she's been in labor. She had cesarean section. So she was having trial of labor after a cesarean section. So they rushed her in, and then she has ruptured her uterus. Wow. She was bleeding, she was pale, she was paper white. People were wailing, they were shouting, "Save her, we'll kill you, we'll beat you up," and all that. But luckily for us, we have people that are surrounded her. They can donate for us, because the woman cannot do. Then our blood bank, when it was functioning, despite the fact that she was RH negative, our blood type, we have negative is very scarce. So we're able to get blood, we resuscitated her, we set line, we needed blood, we're able to take her into the blood bank. We gave her we used up all the blood in the blood bank. But look, it's a rare case that we have people that had a blood type, they were able to donate blood for her. We have people that usually donate voluntarily, because we have sensitized the community about the need for. So we saved her, and then several like that. She survived, we operated her, she survived, and then I think that's because she was a PCV then, she was 6%. A pregnant woman with 6% PCV. That one, she is almost gone. But we saved her, and several other like that that came in and they need blood. Luckily, we have their blood type, and we're able to save them.
I wish we could go on, but let me quickly speak with Mr. Olatubi so he doesn't feel left out of our conversation today. So we have about 5 minutes or thereabout to go. Let's quickly talk about the strategies. What strategies can healthcare systems implement to ensure we have constant access to safe blood and blood products, especially for maternal health care?
Okay, I want to first of all thank Dr. Bande Adegboyega for joining us and helping us to, speak from a practitioner point of view. You talked about healthcare systems, so I will start by our vision, which is to provide, to ensure the availability of blood, safe blood to all who require it. And it takes a lot. So let me start from the part where we have control. Then I will now move to the part where it's in the hands of the citizens. Like she said, blood has no substitute. It can only be gotten from people. You can't walk into a pharmacy and then you get blood. So blood is an essential medicine. It's very vital for public health also.
Okay.
Right. So on our own part, so what have we done to improve, to ensure consistent access to safe blood? That's the question you asked. So what we've done, access, very important. For example, every pint of blood sold in Lagos State is subsidized by almost half of the amount. So what that means is that...
Sorry, let me cut you. I'm sorry. We have a report. There's a loaded tanker at Anthony right now spilling diesel. Fire service, men of the fire service are already on ground. This is in Ward, Maryland, and traffic is set to be very serious now from Onukwan. Well, I will try to find out. I know that I can see right now that on the service lane at Anthony, it is really, really heavy in Ward, Maryland, and the main carriageway is empty. Okay. So we'll keep monitoring that right now. Again, a loaded tanker spilling diesel at Anthony right now. So men of the fire service are already on ground in Ward, Maryland. And I hear the main carriageway is empty right now. It's been cordoned off. So all vehicles are diverted to the service lane. So please just take it easy. So we have men of fire service already on ground. So we'll continue to keep you updated. All right, I'm sorry. Let's go on.
So we're talking about strategies. So one of the strategies for making sure that this blood service, this blood is available, is affordability. That's the first thing. So what Mr. Governor has done is to make sure he has subsidized the cost of blood by almost 50%. So it remains affordable to people. So it creates access of people to have this blood. Remember, I said blood is an essential list of essential medicine, and it's also, that means it's very vital for people. It has no substitute also. So the second thing that we've done, that the Lagos State government has done, is to ensure that this blood, for example, this program we are doing is all geared to creating awareness. So it's part of the strategy to tell people that, you need to come over. That's why I want to thank I want to use this opportunity to thank all our voluntary blood donors who have come forward to provide blood to save lives. Okay, so another thing we've done again is to the efficient processing of blood. So what that means, like what you talked about, women bleeding during childbirth. So they require one of our blood products, which is the fresh frozen plasma, to stop the bleeding. Right, to help with to stop the bleeding. So we've gone ahead to process blood that is safe, and we've also done training. Remember, we said we trained over 200 doctors on the efficient clinical use of blood. So those are the strategies that the Lagos State government, through the Honorable Commissioner of Health, Professor Kiabaomi, and the Permanent Secretary in the Ministry of Health, Dr. Oluwole, and the Executive Secretary, have put in place to ensure that we're able to at least, because WHO says like 1 to 2% of the population. In Lagos, we're about 20 million people. So that means that we need about 200 people, units of blood. So we just have to, we have no choice than to encourage people to please come out. We've done our own part as a government. The people also should also do their own part and come, because we can't get blood from pigs, from cows.
Exactly. We can't. We can't. Thank you so much. Oh, time. All right. Well, I'm sure that we probably would get to continue this particular topic another time, because we still have we've not talked extensively about blood needs in pregnancy and childbirth, because I'm sure that, there's still so many questions that we should discuss. So we would have a repeat or a continuation of this topic, yes?
Of course, because there is major use. That is gynecology, childbirth In fact, maternal mortality. I don't want to talk because we will all be scared because the figures. Imagine
we would have another. Yes, we would have another edition of the program where we will talk more about this, because I don't think we can finish this topic in one edition.
And there's another thing that you need to quickly note.
5 seconds.
Yes, you talk about people coming in from faith-based clinics. Faith-based clinics.
Yes.
They won't come to the hospital at first, though. They will go to those churches, go to all those different places. When there's no problem, they now start rushing them in. So people should please go and register for ANC. They have removed all the barriers for you people. When you are coming, please come with your family members so that we always have an adequate supply of blood in our blood banks.
Thank you very much. Sorry, we're out of time, but you can get in touch with the Lagos State Blood Transfusion Service. On Facebook is Lagos Blood Transfusion. On Instagram is Lagos State Blood Transfusion. On X is Lagos BTS. A telephone number is 0806 920 7914. Again, 0806 9207914. Thank you again, Dr. Adegboyega, and also thank you to you, Mr. Olatubi. My name is Dele Agadumo. Thank you very much to Victor Terry, also to the Executive Secretary, Dr. Bodoni Oshikomaya, and not forgetting our Executive Producer, Tayo Akonle. Enjoy the rest of your day. God bless.